Welcome back. As we promised earlier in this program, we are inviting a very distinguished guest tonight, and we said her name is Dr. Asmhan Almualla. She is a consultant in anesthesia and intensive care, and she has also a specialty in pain medicine. Good evening, Dr. Asmhan.
Good evening, Ade.
How are you?
I'm very well, thank you.
Thank you for accepting our invitation in this program.
It's a great pleasure for me to be here today with you.
Thank you. Actually, we have the habit when we have a guest in our program, initially we'd like to acquaint our viewers about the specialty they are specialized in. So we ask, can you give us a brief idea, how did you reach this level of specialty with this knowledge and skill?
Of course, the pain specialty or pain medicine is a new and it's greatly quickly evolving specialty. I graduated from Glasgow University in 1992, and it's the same university where you graduated, Ghader.
Yes.
And then I established my career immediately in anesthesia and intensive care, and I finished my fellowship in 1998. And then I joined Mubarak Hospital, and then I decided to do a subspecialty in pain medicine. I finished my specialty in 2005, and at the moment I'm working as a consultant in anesthesia intensive care, and but most of the bulk of my work is doing pain medicine, and I'm very interested in neuromodulation, which is the new advance in pain medicine.
Yes. Also, this is something very rare to see, and I've done some homework about you, so you don't have to be embarrassed, but we need to say the truth. Actually, you are the first Kuwaiti lady doctor in Kuwait who specialized in anesthesia and intensive care, right?
Yep.
Not only this, you are the first Kuwaiti lady doctor who took also pain medicine as subspecialty, and you are the one who first launched this clinic back in 2006 in Kuwait for the first time, right?
Yes, that's right.
I know you are so humble, down-to-earth person, but we need to mention these informations. Now, why you came to that interest? We know that intensive care and anesthesia is a very stressful job, both for men, so imagine also for a lady doctor like you. Plus, you also had the subspecialty with the pain medicine. Why you were interested in such specialty?
When I started doing my medical career, I started as a medical SHO. But I did a rotation in intensive care, and I was very, very interested of how can you manage patient as a whole. Intensive care is supporting all body organ without looking at the cause of the failure of all those organs. So while the disease is healing, or while you are treating the disease, let's say chest infection or sepsis, meanwhile you are supporting all the organs like the kidney and the heart and the brain. And that's, I think, it was amazing to me. After that, I dealt as being an anesthetist. We deal with a lot of patients post-operatively to manage their pain. And you could see the difference when you do a good pain management post-operatively, especially if it's a major case like a tumor resection or a heart surgery. You could see the difference. If you give the patient something like an epidural injection that's usually given by an anesthetist and pain specialist, you find the patient next day in the intensive care sitting, eating, coughing, and awake, communicating with his family, and able even to start physiotherapy and free of pain. And next door you can see the next patient who didn't have an epidural for one reason or another, and they are still in bed coughing and unable to communicate with anybody else. They had a lot of opioids given to them either by injections, and they are very drowsy. So you could see the difference, and from there I started to build interest in pain medicine.
So you felt in that field there is a need for such management or for such care, as you said, to manage the pain, whether it's acute or chronic, as you have said earlier on. With your practice and specialization, you've noticed that we need for both branches to manage both the acute type of pain and the chronic type, right, Dr. Asmhan?
Yep.
Okay. Now, let's concentrate on the first, the chronic type of pain, where most patients in Kuwait with chronic problems, regardless of the cause. As you said, you've mentioned some of them who underwent operation, but there are others who complain of low back pain, chronic back pain, and other kinds of pain, or end-stage cancer patients. What are the things that are offered to help them to manage their pain?
Previously, it was very unorganized process. Previously, it was every specialty, including medicine, surgery, orthopedic people, neurosurgeons. All those colleagues were trying very hard, including anesthesia, to manage their patient that they are treating. Like orthopedic treat patient with back pain, neck pain, and patient with a neurosurgery treat patient with tumors, and so on. It was an unorganized process, and they were trying their best, but they weren't into all the advances and the technology which is growing very fast. Nowadays, no. For the last 2 years, and I'm proud to say this, we have now 4 pain clinics in 4 hospitals in Kuwait, main 4 hospitals in Kuwait, and we receive patients referred from all from other subspecialty, including primary care patients. We see roughly 25 patients per week. And what we do a comprehensive full assessment of those patients. And this needs a team, actually. It's not the pain specialist themselves. You need with you a trained a pain nurse, and you need a trained physiotherapist, and you need trained clinical psychologist, and you need all the help from your orthopedic colleagues and neurosurgeon colleagues and other interventional radiologist colleagues. It is what you do, you draw a plan. You do a plan of care, which is an immediate plan of care to try to control their to give immediate control of their pain, regardless, as I said, of the source of the pain. But then you start at the same time to draw a long-term plan for controlling their pain. When you come to the management plan, you start with simple things. First, assessment of the pain. You try to find what is the generator of the pain. And then you start with medical treatment and then more interventional procedures.
Yes. So as you said, there is a free access to your service, both from the primary care sector and the secondary health care, whether any kind of hospital, neurology or surgical or medical department. Is that true?
Yeah.
So we can directly refer for you patients to your department?
Actually, I work in Ibn Sina Hospital, and my clinic is open to every patient in Kuwait. We open file for any patient who is referred to us from any hospital or any primary care or any department. This is, I think, there's few clinics in Kuwait that accept patients from all over Kuwait. Yes. We have other clinics in Adan Hospital, in Farwaniya Hospital, and one in Razi Hospital as well now.
Okay, great. Now, you said that the candidates who comes to you are usually patients, or they come to you have a chronic type of pain. And this is the one we want to concentrate on, what you can offer and your team as a method or a service to help their pain or to manage them or relieve it, to have a better quality of life. So we know there are 2 types. Usually it starts with us with the pharmacological type by giving some painkillers, simple one, and the more, let's say, strong one from non-steroidal anti-inflammatory drugs, both oral kind and injection. And this is generally, it's everywhere, both in the, as we said, primary and the hospital. But we want to talk about the special kind of pain management in your department, and that's the non-pharmacological type, with the between brackets. So can you elaborate more, Dr. Asmhan, on that type?
I'd like to mention something before we move from pharmacological methods of treating patients. Yes, I agree. We have the usual analgesic drugs that we use in the primary care and in the hospital, which is available. A lot of doctors have experience with these medications, but when it comes to the other medications we are using, in addition to this medication, we still use them, but we use more powerful drugs like opioids, like controlled drugs, and we use them in a different methods like patches, like eye injections, or epidurally or intrathecally, and these are the